National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Dr. Jonathan Beatty, naturopath and a health expert here at Nationalnutrition.ca. Today we're going to talk about something called cervical dysplasia. Now, many women who've had a pap smear before may have actually been called back into their doctor's office to discuss this thing called cervical dysplasia. It's nothing to worry about in the immediacy. If you do have it, not the end of the world. The reason we're concerned about it is that cervical dysplasia in some cases can develop into certain types of cervical cancer. So that's important. Now the cervix, most women should know this. Some guys out there who might be watching this may not be aware of what it is. It's essentially the entranceway into the uterus. And so the cervix is basically at the bottom or the inferior portion of the uterus, and it's a small opening through which essentially a baby will be birthed. So that's what the cervix is. And dysplasia basically refers to abnormal growth of the cells of the cervix. It's a little different. In some cases you can actually get what we call atypia, which is where the cells aren't differentiated or matured enough to be classified as abnormal, but they're just immature cells. So there's two different things you can get. Today we're going to speak mainly about cervical dysplasia as opposed to cervical atypia. So the dysplasia is, again, that abnormal growth of the cells. It's not necessarily abnormal growth in the sense of cancer. One of the ways to think about it is a potential precancer. And again, the key there is potential. Not all dysplastic cells inevitably become cancerous. It just tells you that you are at an increased risk of that outcome. Now, there are no real symptoms of cervical dysplasia. The way it's diagnosed is actually through regular pap smears. And any sexually active women should be going in for regular pap smears just to evaluate, again, for cervical dysplasia and, again, the presence of cancerous cells. So if you do have it, like I said, it's not the end of the world. It is something that can be easily treated, and in fact your doctors are likely to recommend either a 6-month or 12-month follow-up where you'll have your pap smear repeated to see if the abnormal cells are still present. In many cases they do what we call spontaneously resolve, which is, one pap smear might show you had abnormal cells, and then the very next one, without any changes in your lifestyle, might show that it's gotten better. That being said, there are things we can do as opposed to just sort of sit and wait and see if it gets better on its own to ensure that you're not going to get that cervical dysplasia on a follow-up. So today we're going to talk about a few of the strategies you can use. Some of the things that we've seen: increasing vegetable intake. Pretty much for any type of dysplasia, this has been shown to be very effective at reducing the development of abnormal cells. So ensure that you take in adequate fruit and vegetable intake in your day. Very important. Of all the fruits and vegetables to take in, I would typically recommend increasing your brassica vegetables. This is the brassica family, sometimes known as the cabbage and cauliflower family. It also includes things like kale, mustard, Brussels sprouts. So, hopefully there's something in that little list I gave you that you like. And these vegetables, they have special abilities and special compounds within them that help our bodies to manage estrogens and progesterones and other growth hormones that would be associated with the growth of dysplastic cells. So if you can help, again, manage your growth hormone, manage your sex hormones, that can help to reduce the likelihood of the dysplastic cells from forming. Additionally, other herbs that have been shown to, or other supplements that have been shown to help, vitamin A has been shown to be very effective at helping to manage dysplasia. The only thing you need to be aware of is very, very high doses of vitamin A can be toxic, and as well, very high doses of vitamin A should not be taken during pregnancy or if you're planning on getting pregnant, because excessive vitamin A can be a bit of a mutagen and actually cause mutations in the developing child, and in some cases result in spontaneous abortion. So it's really important that if you are using some of these supplements, you understand how to use them safely, and typically I do recommend working with a medical practitioner just to ensure that you are going to be performing these things safely and using these supplements safely. In addition to taking vitamin A, some of the other things that you can look at that have been shown to help: gamma-linolenic acid, often found in evening primrose oil, or some people like to find it in black currant oil. This specific fatty acid is very effective at, again, helping to normalize hormone function, and has been shown in some studies to help reduce the level of cervical dysplasia. So if you do have it, like I said, it's not the end of the world. Many times it spontaneously resolves. That being said, why not, just get rid of the risk altogether, make those few lifestyle changes, increase your vegetable intake, look at supplementing with a few vitamins, vitamin A, gamma-linolenic acid. These things could really help to reduce your risk. So if you like this video, please check out more of our natural health videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.